So before we jump in, I know many of you, but I might be a new face to some of you. So my name is Sarah Fiorenza. I am the project director for Texas System of Care with the Health and Human Services Commission. I came into this role back in February, so I've been doing this for about 6 months. I am still learning a lot, but it's been really exciting to kind of jump into this work around system of care. Just a little bit about my background. So I have been with HHSC for the last about 8.5 years. And a lot of my work has been focused on Medicaid, both on the Medicaid eligibility side, as well as the Medicaid chip and service, Medicaid and chip services side. Sorry about that, y'all. So that's kind of where I've been over the last several years. But when I first started with the state, I actually was with our Community Resource Coordination Group program at the state office. Oops, there's an echo. So that's how I got started. And just a little note about that. At that time, there was one full-time staff member and 2 interns, and I was one of the interns. And just this past month, we have hired 6 new CRCG team members at the state office that are located throughout the state of Texas. And they are on this call with us, and they are just being onboarded and getting up to speed. So just a little side note, that's something that's really exciting that's going on at the state level related to this work. So a little bit about the structure of this call. So we have Sonia Hartman with us. She's going to talk a little bit about the Children's Partnership. We're going to talk a little bit about sustainability. But if you'll remember, as y'all were logging on, I asked you a question, and we're going to do that waterfall chat. So if you want to go ahead and start typing in those responses and pressing enter. Again, the prompt was, when you hear the word sustainability, what are the first 2 or 3 words that come to mind? So go ahead and type in, press enter, and we'll see what we've got. All right. So we've got last over time, able to maintain, access, consistency, stable, sufficient, long-lasting change, simplicity, organized, feasible, built to continue over time, funding, services, staff, communication, and collaboration. Yeah, I think we're going to hear a lot about collaboration, long-term implementation, funding, successful, maintaining, again, excellent. Yes. A lot of people are talking about funding, understand that part. The future, self-sufficient, that's a good one, right? How do we get to that place of self-sufficiency to sustain over time? Preserve and support over time, and retention, right? Having a good employees, having a pipeline of community referrals. Yeah, I think that that's great. A great way to get us started. I think for me, I think a lot about resiliency, right? For something to be sustained, it has to be adaptable and flexible as a community's needs changed, as the political environment changed. So yeah, those are some great responses. So before I jump into Sonia's piece, she is going to give us a bit of a presentation for the first half. And then the reason that we're really wanting to focus on sustainability, that ties into, for us at the state level, we're about to start the 4th year of our 4-year grant from SAMHSA. So the current grant period began in August of 2021 and will be completed in August of 2025. And this grant has been focused on increasing access to school-based mental health services. So we have been working with 3 sites, and those sites are on this call today. We've been working with Integral Care, we've been working with Emergence, we've been working with Pecan Valley, and they have worked to develop local systems of care, partnering with school districts and developing partnerships with certain schools and providing mental health services in those schools, including youth peer and family peer support. So of course, since day 1 of the grant, we've always had this frame about sustainability. But as we get closer to beginning year 4, it's something that's really front of mind. And then really for this larger group, right, we have our 3 sites that we are working with right now with this grant. But on the call with us, we also have you all who are doing other system of care related work in communities. Maybe you have received federal funding at some point, maybe you have not. and really kind of wanting to look at sustainability from that lens as well, and see what you all are doing and see what benefit this information can provide to you. Also, when I think about this call, we didn't have our call back in May for this quarterly call, and I'm really wanting to see how do we make this a space for us to learn and to share with one another. So that's why for today we're going to have a presentation, but then we're going to try to have a little bit more of a facilitated discussion, really hoping to kind of give us a chance to brainstorm, to strategize with one another, to share with one another, and really allow this to be a space where we all can do that. So before, when you registered, you might have seen a few questions that were asked. Those questions were, what 1 to 2 things does your local system of care do really well? Have you been able to sustain these elements over time? And what are some ways that system of care values and principles have been successfully embedded into your local system of care? So I want you to kind of have that in the back of your mind as you're listening to Sonia Hartman do her presentation, with the understanding that once she finishes, we'll have some question and answer, but then we'll go into a little bit more of a structured discussion around those pieces. So with no further ado, I am going to introduce Sonia. We're so excited that she is here with us today. Just a little bit of information about Sonia. She is a program administrator over the System of Care Behavioral Health Unit at Travis County Health and Human Services in the Office of Children's Services. She provides direct oversight to the Children's Partnership, which is a sustained system of care program. It has been sustained since 2005. She provides supervision and technical assistance for the Travis County System of Care initiatives. She is also chair of the Travis County Community Resource Coordination Group. She has over 33 years of experience in juvenile justice and mental health. She is also a trainer for system of care and wraparounds with Travis County Health and Human Services, and she has experience working collaboratively with families, community resources, and private providers. But most of all, she is a parent with lived experience and an advocate for children, youth, and families. Amazing. So with no further ado, take it over, Sonia.
Good morning, everyone. Thank you all for joining us this morning. I look forward to any questions. You can save questions to the end, or you can ask them as I'm talking. I'm going to really focus on our system of care community here in Travis County, which may be different because we are, we're in a major city versus some communities that might be more urban. Might be more rural. So, but I think everything that we talk about can apply to any community that you're in. It's just modifying it, and just like it was stated, that resiliency piece, we have to change over time. So in the presentation at the very end, it's going to talk about barriers, strengths, and things that we learned and that we're continuing to learn, because we continue to learn each and every day, each and every year, as things change within the climate, things change with the populations that we serve. Our system of care community here in Travis County is a child serving system of care community. So the youth is our identified person. And so I just want to put that out there in the beginning so that you know. I know sometimes there's system of care communities that may work with older youth or with young adults or even adults, but I wanted to share that. So I'm going to go ahead and share the PowerPoint. Let me know if you can see it. And I can provide this PowerPoint. They have the PowerPoint. You can share it with the entire group.
Perfect. Excellent. We can see it, Sonia. Thank you.
Okay. As I was telling Tammy when we first started, I like to see the group when I'm training. So I need to open up my other screen so I can see you guys. That's just telling you who I am, and I've already had that introduction. Now my keys don't want to work. We just have all kind of technical issues this morning. There we go. So just going to talk about in the beginning. I prefer not to read to people because I know you guys all know how to read, but this is just basically stating that in 1998, Travis County did receive a SAMHSA grant through the Comprehensive Community Mental Health Services for Children and Their Families. And it was under the Austin Travis County Children's Mental Health Partnership was created, commonly known as the Children's Partnership, or TCP. This was our second time applying for this grant. When we first applied, we did not get it. We got it the second time that we applied, and it was a 7-year grant. And the goal was to create an organized system of care for children with severe emotional behavioral disorders and their families that resided within Travis County, Texas. So we do not serve kids that do not reside in Travis County. We wanted to bring in coordination, so there's care coordinators involved. We wanted to bring in family voice, youth voice, and abide by the values of system of care, of it being community-based, family-based, individualized services, and culturally and linguistically competent. And if I go too fast, please tell me to slow down, because I don't see the chat. So if somebody asks a question in the chat, I cannot see it. So these were our original partners: Texas Health and Human Services Commission, Travis County Health and Human Services, Juvenile Probation, our local mental health authority, which is Integral Care, DFPS, which is more of Region 7, the Texas Education Agency, CRCG. And if you don't know what CRCGs are, but assuming you guys are in the state of Texas and know that, what community resource coordination groups are. If not, just let me know and I can explain what those are. The Texas Department of Health, Texas Rehab Commission, Substance Abuse Services, Mental Health Association. In the beginning, we had a lot of partners that created this grant and bought into this grant in order for it to work. So we had, and these are the rest of the partners. We had family representatives, early childhood, and children's quality committee. And all these partners wrote the grant, and it was received, and it was determined that the grant would be brought out in a certain way. And so they wanted to utilize what's called the wraparound process. They wanted, which is through the National Wraparound and Implementation Center. Back then it was in Maryland, now it's in Connecticut. They wanted to take on that process as well as the values of system of care. And then we had a mission and vision and values that were created as part of that grant, and that we continue to abide by today. And the main thing was to make sure that children with social, emotional, behavioral needs can live successfully with their families in the community. Create a new bond between families and the community at large. And the reason for that new bond is working with families differently. Instead of mandating what it is that they need to do, but truly partnering with families, getting their voice, getting them to create what it is that they need in order to sustain their children at home, what supports, and how to empower parents to advocate on behalf of their own children, because they are the experts. And then looking at diversity, spirituality, strengths of the family, trying our best to meet the linguistic needs of different families that we come across, and making it community-based. We understand that children may have to go to short-term psychiatric facilities, or they may have short-term residential treatments, or they're coming home from residential treatment centers. But once they come home, having it to be where they could be sustained in their community. I'm pretty sure all of you guys know it's easy. It's a lot less expensive to keep a kid at home and wrap around with intensive in-home community-based services than it is to place a kid in an RTC facility. And it's also allowed us to prepare the family for that child coming home, to get a better understanding of those diagnoses, and to understand that it's a diagnosis. It doesn't define who their youth is, and it doesn't define who their family is, and that they can live with a diagnosis and how to educate themselves on that and what's going on with their family and with their children. Because even though that child may be the primary client, mental health, intellectual developmental disabilities, whatever it may be, impacts the entire family. Some of the success factors for sustainability, and I wrote down some of the things that you guys wrote when you did that waterfall, and some of the things that are up here. Funding is very important because you're getting all this money from SAMHSA to do this 7-year grant, but how am I going to sustain it once this grant is over? How are we going to continue to provide the community what we've been providing them for the last 7 years, even if it has to be on a smaller level? But how do we do that? So funding is important. You have to have a board of directors who's leading this. And you have to have that collaboration. A part of those board of directors have to be the people that can make decisions, that can add funding to your resources, that could advocate within courts or within their own budget to see if they can expend dollars to support the continuance of that grant or of the structure that you put up. Program and infrastructure, which was created, stakeholder awareness, family involvement, training, and quality assurance. I would love to say that I was involved in the creation of the Children's Partnership. I was not. At that time in 1998, I was in probation, being a probation officer. And when the grant ended in 2005, I think I was still in probation, but maybe doing CRCG at that time. But it's the people that came together. It's those leaders that came together with the creation of this grant. And once that grant is created, even if everybody's not implementing it, they have to be a part of it. They have to have that buy-in into it, that this is going to make a difference. And how is this making a difference in our community, so that they can continue to be involved as the grant starts to end. And the people that wrote this grant, that helped implement it and put everything into place, began sustainability at day one. So the same thing as when we talk about with wraparound, transition begins day one. It's the same thing with the grant. It has to begin day one. You have to be thinking forward about what it is that you want to continue and how are we going to do that? How can we partner to keep this grant afloat, or to keep the services and the program afloat? We did establish a board. I have maintained those records. I came over in 2012 as the program administrator for the Children's Partnership. I've read, I think, every board meeting notebook that they had during the grant days, just to get an understanding and an overview of everything that's gone on. You got to have policies and procedures. You got to have MOUs, as you guys already know. And you got to identify those key stakeholders. Who is it that's on your team, and how do we keep them invested? And that's one of the lessons learned, is at the end, it's like you have to go back, you have to retrain, you have to keep that line of communication open. And somebody put communication and collaboration, because people leave, people retire, there's turnover. Like example now, the people that were there when the grant was created with juvenile justice, the chief that was heavily involved is no longer there. A lot of the people that were there when I was there, that knew what the partnership is, have gone on or retired. So we have to continuously meet with our stakeholders and really remind them why we have this collaboration, what the memorandum of understanding is, how can we expand it, how can we keep it afloat, how can we keep your funding contribution in our flexible funding pool. You have to keep those relationships open. So you have to know the history. So you have to know how to communicate with those people, and how to get meetings set up when you see that turnover coming. And getting somebody to advocate within those agencies as well, not just the people that are doing the work on the ground, but you have to have some people higher up in the administration. So we decided, and I've mentioned this before, and if you see behind me, I have the System of Care values. It is a flyer that was originally given to us when we became a grant. Some of the wording has changed with System of Care. Right here it says culturally competent. We've added culturally and linguistically competent now. So it just depends. And so it really, it's still child and family driven, and it's still community based. But we have this photo also framed, and it was a poster. So that's why it's my background. And it reminds me of what it is, the work that I'm doing, and why it is that I'm doing this work, and the reasons behind it. So I apologize. I have a grandbaby behind me that's bothering me. As Tammy mentioned earlier, we were talking, we're on double duties. Yes. Sometimes. Wraparound, we implemented the wraparound process. We sent all of our staff to trainings with NWIC. As part of the grant, We were supposed to maintain that fidelity to wraparound. We had trainings every 6 months. We had people come to us and we went to them to make sure that we were doing the work that we wanted to do, and that they were giving us coaching, and that we were maintaining an approach to that. And when we're talking about system of care, we're talking about the values and philosophy, but we're also talking about bringing in those agencies and really helping them to understand the work that we do, because everybody doesn't use it. Everybody doesn't know what wraparound is or system of care is, and these have become words that are involved in various agencies across the spectrum. Because you'll hear about wraparound services, you'll hear about system of care, and everybody has a different viewpoint or definition of it. But for me, it's really about ingraining these values in the work that we do and in the partner agencies that we work with, but also a system of care is bringing all those people together, which also is what a wraparound is about, bringing all those people together and wrapping that family around all the services and supports and leakages that they can get in the community. Development across agency processes. How are things ran? What is juvenile justice doing? What is Integral Care as our local mental health authority? How are they partnering with us? And we were blessed to have our local mental health authority as a partner in the partnership, as well as a writer of the grant as well. A managed service organization. And what that was is that Integral Care, our local mental health authority, became our managed service organization, which means that they managed our dollars. They contracted the providers. We utilize their provider networks now because they continue to be our managed service organization with the credentialing and the training of providers. Having a provider network, families need services, and it's not always, and as you know, since COVID, services have dwindled to some extent, even though we're in the post-COVID and we're in an urban city and we should have all these resources. Travis County is having some of the same struggles as our most rural counties in the state of Texas are having. So it's really about that provider network and building it up. And how do we pay these providers? How do we get these people connected to resources? Because all of our families can't afford to pay for the things that they need. Some of them are just making it day by day. And then Project Merge, a single point of entry. I'll talk about CRCG, TCP, and Triad. CRCG is Community Resource Coordination Group. And for those who may not know what that is, back in 1987, the legislature in Texas mandated that every county in the state of Texas have a CRCG. And what it was, in my definition of it, the way I like to explain it, is that it is a catch-all. It is a community collaborative meeting with stakeholders that are involved with children, youth, or adults. CRCGs look different across the county. Some are adult serving, some are family serving, some are children serving, or they do the entire thing. And it's for organizations to come together and do like a multidisciplinary staffing, coming up with resources and supports, coming up with ideas and recommendations, kind of like a one-stop shop brainstorming meeting for these families who have high risk, in and out of systems, multi-system involved, substance use, IDD, mental health, but just and they're still falling through the cracks. And we want to catch those kids that are falling through the cracks. Children's Partnership is our system of care community. Triad was created, and it was created through Travis County Juvenile Probation and Travis County Health and Human Services as a funding source for short-term out-of-home placement for non-adjudicated or kids who are not on probation youth. We no longer have the Triad program, but I'll tell you how we merged it toward the end. But and what we did is that back in the grant days, parents would have to go to all three of these staffings. So when the grant ended in 2005, we merged that into one single point of entry, that being our CRCG, to access all those, to access the Children's Partnership or any funding for out-of-home, short-term out-of-home placement has to come through the CRCG. Just to make it easier on families, because they'd end up back where they started from, which is not what we want them to do. They're already overwhelmed. Collaboration with family groups, getting out there with NAMI, getting out there with parent-to-parent resources, whether it's VELA is a parent group resource group out here, the Parents Resource Network that helps with advocacy and linkage regarding special education. But you have to find those groups out there and get those parents involved and work with those families. It's hard to, I mean, now it's a little easier because Medicaid is covering some of those supports, but back in the beginning, there were not paid family partners or parent liaisons, which is what we call them in the partnership. People with lived experience that were working on boards and working in the community with families and partnering with us. There were not these peer supports that we had. There were not youth that were involved in systems that were advocating on their own and being a part of boards and other collaborations. But now, as time has progressed, we've learned the value of having their voice. We've learned the value of family. We've learned to realize that systems are not, my personal belief, systems were not meant to raise children. Parents are their experts, and so therefore we have to involve them. And it's not just a bobblehead effect of involvement. So it's not like the parents just doing this or the kid. It's really listening to their voice, listening to their experiences, having them to make decisions, having them at every avenue that you can to inform and to make the program better than what it is. Family voice and choice, training and curriculums. You have to have trainings. It doesn't matter how much training you have. Things have changed over years. We've been sustained since 2005. What's that? 19 years, I think, if my math is right, somewhere in there. Things have changed from when we first started. And so we have to keep up to date with what's going on. We have to continue to learn about our partners, learn what programs they have, what access they have to funding. How can we blend that funding, grade that funding to support the kids that we're all serving? Family voice and choice has to be at the table, and there has to be an understanding of what that means. Family involvement in the Travis County system of care. And you'll see when I'm continuing to go down, one of our struggles has been maintaining a youth voice. And we're continuously working on how can we get that youth voice within our board and within our system of care and our CRCGs and stuff like that. So that's always been our hardest struggle. Because it's paying for funding, it's paying for them to be there. How do we do it? How do we modify the times? Just different things that you have to look at when you're creating and making things accessible for families and youth. Any questions so far? If not, I can wait to the end. I just want to make sure I hadn't missed anything. Training and quality assurance. So you have to maintain fidelity to the wraparound process, which is what we decided on. So all of our staff are trained by NWIC, which is the National Wraparound Implementation Center. And then we also do a in-county training that we do twice a year with our partners to go over the foundation and the basics of wraparound. And we have a graduated family member as part of that training. And then we also have to have refreshers. Sometimes you have to go back through, even though you've gone through wraparound 101 and intermediate and supervisors. Sometimes you need to go back through and refresh yourself, because one of the things that happens is that complacency or going back to the way things used to be. Instead of really abiding by and listening. When we were in a grant, we had coaching, we had people coming out and auditing us and things of that nature. Now that we're sustained, we don't have that. So it's up to us to audit ourselves. It's up to us to ensure that our staff are trained and that they're abiding by the philosophy of wraparound and the principles of wraparound. Cross-system education and training. Our training team trains not only our staff at Travis County Health and Human Services, but staff that we partner with, staff in the community. We go out to the school districts. We'll go anywhere that somebody is asking us to go to assist in training and to let them understand who we are, but also finding out about the other entities and what they're doing. The juvenile justice from when I was a probation officer from 91 to 2011 has changed. in the last, 12 years that I've been at Health and Human Services. So I have to be able to be educated on what they're doing, what programs they have, how we can partner, how we can help them out. And same thing with whether it's CPS, the school districts. You have to have that cross-system education. You just can't assume that this is how that works, because each system is its own culture. And we need to learn what goes on within that culture. So not only for ourselves and our collaboration, but also for the families that we're working with. We've already talked about a training team. Even if people go out and do trainings out T for T's on other subjects, training for trainers on other subjects, but having people internally or having people that you connect with, whether it's at the state level or the national level, that can come out and do trainings or webinars, but keeping, you have to have your mandatories for people to stay fresh in what it is that's going on in the community. And then policies and procedures. We created policies and procedures for the Children's Partnership. We update those policies and procedures based on the climate that we're in, based on changes within our organization. The same thing with the MOU, you have to keep that up to date. If partners change, you add partners, whatever it may be. Funding. Revenue maximization. So we had all that money with the grant. It was great. It was wonderful. We were able to spend so many dollars a year on families, getting them services and supports, wrapping them tightly with all of these things. And the question that comes to mind when you're talking about sustainability is, how am I going to keep that up? How am I going to be able to help families access these resources that we've been paying for? We were paying for therapists and mentors and non-traditionals and family partners, parent coaching, particular therapeutic modalities, things that Medicaid or insurance didn't cover. And I don't know about y'all's communities, but the majority of families within our system of care or that are accessing our services are 200% or below the federal poverty guideline level. So they're working day to day. They can't miss work. They can't skip out of work. They don't have vacation to take time off to do the things that they need to do. So they need that funding in order to support their kiddos. We also became a 501c3, a nonprofit underneath Health and Human Services. Services and support, staff sustainability, and that was one of the things mentioned earlier, is that retention of staff or a retention of somebody that knows what was going on. So as staff transition on, whether it's going within your own program or going somewhere else, having somebody that knows that history, having somebody that can come in and believe in what it is that you're believing in. Having a body doesn't just count. You got to have people that are willing to advocate for what is needed because they believe in what it is that you're doing. That it's not just a job. Braided, blended, and flexible. That's what your funding has to be. So weaving together more than one funding source. And that comes with that collaboration that somebody talked about in communication, and consistency, and keeping those long-lasting relationships with the organizations that you began this journey with, and finding new relationships. Pulling the funds together, and then flexible. Because whether you're doing the work yourself, whether you got staff that are on the ground doing the work, one of the things across the board, no matter where we might be, is that families are struggling in this economy. Whether you're in an urban, a big city, small city, the rural area, or you're in an area where there's 4 counties being accessed under this one grant. At the end of the day, families' needs have to be met, and helping them to access those basic community or those basic resources to live is important, because they can't focus on the work that they have to do for their children or for their family if they're worried about rent or food or having or evictions and things like that. And I know I may be preaching to the crowd, because the work that you're not in this business if you're not a believer of advocacy and supporting the families in the community that you're working within. So the evolution of our system of care. So in 1989, CRCG was created. We were one of the first pilots for CRCGs. And so our CRCG group has been around since 1989. 98, we got 98, we got the grant. 2004, 2005 is when we created what we call Community Partners for Children. That is when we took those 3 different staffings and combined them into one. 2005, they sustained the Children's Partnership. We integrated Triad into System of Care in 2005 as well. We also have some other entities within Travis County that we put underneath our System of Care umbrella. And one is we have community centers here in Travis County, and they have social workers, and those social workers also can access some of those flexible funding and dollars, or trained in wraparound, or trained in System of Care. And so that's another program. They also created a program called CPS Reintegration, which was for those kids coming out of care that had been in care for a long time. And how do we sustain that kin or fictive kin return and monitor and get that family ready for that kid coming home after they've been away for a while. And then there's the YES waiver. And then the asset grant collaboration, which is another grant that we were a local supporter of. I'm sorry, I have 2 screens and my mouse keeps moving to the wrong screen. Where we are now, like I stated, we've been sustained since 2005. Our board of directors and the executive committee. We've also established what was recently established probably within the last 2 years is we have a System of Care Community Advisory Board that we are currently falling under, and we are adding additional members within that System of Care Community Advisory Board. And what that does is it encompasses all the entities of System of Care and other agencies in the community that are also doing the work. So it has Dell Children's Hospital on there and their mental health unit and program. We have the different school districts that we work with, NAMI, and communities and schools and other agencies coming together to figure out how do we sustain the gaps? Where is it that we need to improve? How do we advocate for what we need in our community? Flexible braided and blending funding, I talked about that. Sustained positions, I'll talk about that in a minute. Expansion of the Children's Partnership, I'm always, as the administrator, looking for ways we can expand our partnership. How do we get new partners on board? We've lost partners over the years due to changes within school districts or people budget cuts, people having to be moved from one position to another, or having multi-positions, internal training team, and then family voice. It always has to be there. How we sustain the Children's Partnership. So these are our current partners, but how we sustain the partnership was that in 2007 and from 98 to 2005, part of that original team of people with those brilliant minds thought about sustainability. And so what happened is that Travis County Health and Human Services, which is my home agency, proposed that they would take on some of those positions in order for the Children's Partnership to continue to live. Integral Care and Juvenile Justice also were in agreement with it, as well as the rest of our partners. And so what happened is there was a proposal provided to our commissioners court here in Travis County because they approve our budget. And so as part of that, there was System of Care funding. There's a System of Care budget that we fall under, and that budget took on the program director position, the quality assurance position, 2 care coordinators, and then 3 parent liaisons, which were what we called our families with our persons with lived experience working directly with our families. So those positions were brought forward underneath that proposal, and Travis County Health and Human Services sustained the Children's Partnership and took on the responsibility of those positions. So the Children's Partnership is now underneath Travis County Health and Human Services. It is one of the programs that we oversee, and then it's part of the Office of Children's Services. And so that's how it was sustained. And what ended up happening is that so much money was being put into this program by Health and Human Services. Travis County Juvenile Probation pledged so much as well. And then Integral Care also pledged so much towards the sustainability. And that allowed us to look at how can we provide services to family. And so that's how Integral Care continues to maintain as our managed service organization. We do have income requirements. In order for the county to pay for any services, families have to be at 200% or lower than the federal poverty guideline level, which is the majority of our families. And that's just for us to pay for services. You can do wraparound, you can implement system of care without funding, without paying for any services, because it's a value system. It's about the way we work with people and connecting them in the community. And so every year that funding is provided. And we look at how we're utilizing that funding and what agencies are tapping into that funding. Our school districts, they did not have funding, but they provided in-kind services. So in the beginning, in 2005, we had Del Valleys, Manor, Austin ISD, which is our biggest district, and Pflugerville ISD. They provided staff or care coordinators within their school districts, and they paid for those staff. And then in return, they were able to access the funding source for services for families, and they worked on behalf of the Children's Partnership. So as you see on this list now, you see we're down to 2 school districts, Austin ISD and Del Valle ISD, that still have care coordinators within their schools. Manor ISD had a reorganization. They had some funding cuts. They had a lot of challenges and weren't able to maintain that care coordinator position. We're continuing to advocate for that within the districts. Same thing with Pflugerville. We just lost that care coordinator last year. Kind of the same things. They're building more schools. They need their social workers. The climate's changed since COVID, more crisis type situations, families needing more support, kids needing more support in school. But we did add a care coordinator at Integral Care IDD. And then Region 7 is always a partner. It's been hard to sustain a care coordinator though within Child Protective Services. But I will update you on how we do have that partnership with them and how we're serving some of those kiddos with care coordination. And then Travis County CRCG, even though this is a community collaborative meeting, what also makes our CRCG a little different than other CRCGs within the state of Texas is that we have paid positions. So Health and Human Services has a CRCG program coordinator, and then Juvenile Justice holds the county CRCG program coordinator position, and that is a funded position, and that is in collaboration with Integral Care as well for that funding. Lessons, barriers, and growth. Expanding and maintaining stakeholders. I am always out there. I have board members going with me. I'm scheduling meetings. A lot of my job is communicating and collaborating with people and getting out there, telling them about system of care and wraparound and how to make knowledge of it, meeting with judges, meeting with district attorneys, meeting with public defenders, meeting with the people within the school districts, whatever we have to do to get out there to let them know what's going on in our community. Because a lot of people don't know. A lot of families don't even know what CRCG is, and stakeholders, even though it's been around since 1989. Capacity is always an issue. And how do we keep, you got to fill caseloads in order to get more positions. But when you fill caseloads, then there's capacity to serve. Funding, we have to continuously talk about funding. We're always looking for a new grant or new resource to access to get funding. I talked about this already, building and maintaining those collaborations. We are currently looking at a grant that we may be able to apply for to do some expansion of TCP, continuing those providers and supports, which has been extremely difficult since COVID. A lot of people dropped off networks, or they don't want to do in-home anymore, or there's just challenges with rates, with keeping competitive rates for providers. I told you earlier, we have our family voice is there at the CRCG and within System of Care and TCP. The harder piece is that youth force, and we're always working on that and figuring out how we can do it. We had it for about 2-3 years with Via Hope, and then we've lost that collaboration. So we're always looking at how do we bring that piece back into our programming, and then community involvement. How can we get the community involved? How do we get out there and collaborate with communities, whether it's resource fairs, whether it's presentations, but really spreading the news of the work that we are doing, because we are very proud of the work that we are doing. And then when funding is not an option, maintaining the values of system of care in all you do. Because we have families that we work with that, make $300,000 a year. And so we can't pay for services, but we're connecting with them. We're utilizing the wraparound process to look at how things are different, and to get them to look at their strengths and to empower their voice and to advocate and to research. So we're still doing all that work without utilizing any of our dollars, and getting people to really believe in these values. It's one thing to say them, it's another thing to believe in them. And getting families to also understand where it is that we're coming from, even if they don't buy into everything that we do, but the reality of being real. And this is what I tell my care coordinators of working with families. They can tell if you're there for them or if you're there for a job. What can be reinvented or remodeled to meet our community needs? We've had so much stuff that has come through the legislature that has impacted across various ways that we work with children, and various systems that we've collaborated with. And so you have to be able to look at yourself. And I tell myself this all the time: change is good. Change is okay. I don't have to stay stuck in what I know, but part of improving the program is also making changes that are for the better, and taking in other people's opinions, and getting other people's voice involved. That's not so tightly close, because the Children's Partnership is my baby. And so I have my vision of what I want it to look like when I leave, but I also have to listen to other people because they're looking from the outside in. Adapting to legislative, state, county mandates that have come out. Change is ever changing, and we have to know that. One organization cannot break or fix a broken system. And I say that because your organization cannot fix everything that's wrong within our state. We can't fix that we're 49th in the nation when it comes to services and supports for children and youth and adults with mental health and IDD. We can't change the fact that DFPS has a system that may not be working as effectively as we want to right now. And so we have to, and part of that is realizing those things, but what can we do to support those systems that are broken? Because these are all of our children. And that's why I said, don't fight it, but unite it, because it's all the children. We're each touching these kiddos in one form or fashion. So it's not about them or they. It really is how do we come together? How do we collaborate, communicate? How do we maintain resiliency, access funding across different funding streams, so that we do have long-lasting change that can sustain? If it can't sustain the whole program, what parts can be sustained? What can we turn this whole program into to where we're still serving our community, and looking at it like that? And so maybe you don't get 100%, but if you can get 80% of that pie or 75% of that pie, how do we revamp the pie to still serve the families that we want to serve and do the things that we want to do within our community, with or without funding? And then having those people that are out there on the line looking for that funding, out there, basically being that used car salesman. You're really out there. You know how you go in the car lot for one thing and you come out with something totally different? Or the T-Mobile store. I went to a T-Mobile store the other day just for a phone. I came out with a speaker, something to connect it to, a screen protector, a case. I came out with about 10 different things than what I actually went into that store for. And that's the same thing with the work that we do. We're selling it. We believe in it, but we got to get others to believe in it. And even though the work is hard, and I know it's hard, we have to stand firm. One of the major principles of wraparound is unconditional care, or unconditional commitment. And that's what we have to have, because we have to remember our end goal, which are your children, youth, families, or adults that we're working with. That vulnerable population, that population that needs somebody to stand up for them. Thank you. And I believe that is the last of my slides. And I think I stayed within time limit. I don't know.
You did perfect, because we got started a little bit late, and I think we were looking at 11 o'clock, and it's Oh, it just turned 11 o'clock. So that was perfect, Sonia. Thank you so much. That was so insightful, so helpful. I have a few questions on my side, but first I want to open it up to the wider audience. Do you have any questions that you'd like to ask of Sonia?
Please be sure and unmute yourself.
Oh, hey,
Yes,
Jennifer.
that is important.
Sonia, I want to ask about all the stuff you got at AT&T. No, I'm just kidding.
No,
I'm like, I can't go into that store without walking out with something.
something else. And then I'm loving everything I walked out with. But
I know exactly. No, I loved you ending on that comment that, we really have to believe it. And sometimes we kind of have to sell it. Building those relationships with people over the years. I think you hit on that a little bit, but I don't know if you could talk a little bit more about that relationship piece and, that does, well, I don't know. Does it happen overnight? What does it take to really cultivate those relationships, especially with those care coordinators? Because it's right. I think a lot of those care coordinators, it's other job duties as assigned.
Yeah, it takes a lot of work. And sometimes, I mean, I'm a program administrator, so I have my director that's above me. Sometimes I have to bring her in, or sometimes it's a collaboration with somebody from the board because they know that person. With the care coordinators, they are all, we have 2 within health and human, no, we now have 3 within health and human services. So one of the things we changed, and I said I was going to mention about DFPS, is that the program that used to be called CPS reintegration folded. And so we took on those 2 positions underneath my program. So we have one that specifically works with those families that are DFPS involved and are coming mainly to maintain or retain their living arrangement as they're transitioning out of TMC or PMC of CPS back into the community to a parent, a friend, whoever it may be. And then we also created another position under our CRCG to provide short-term case management, which is new for us, but we realize some families need that short-term case management in order to go forward to delve into some of the deeper stuff that needs to be delved into. Our other care coordinators, one is solely Children's Partnership. The other one at the school district does have 2 different jobs, and it's really working with them, going back out there every year if they have a new administrator, if they have a new director over special education, which both of our coordinators are under special ed. With Integral Care, we have 20 spots, which means all their staff, majority of their staff can provide wraparound on the behalf of the Children's Partnership. We collaborate with Yes Waiver, so we have families that are enrolled in Yes Waiver and the partnership at the same time, as well as some other programs in the community, because it's not a duplication, because we can cover some services and supports that Yes Waiver can't. We are not a Medicaid billing program. Also, I wanted to stress that, so we don't have some of those requirements and things that Medicaid puts upon organizations. But it requires a lot, like the chief of probation when she retired. She'd been there ever since I'd been there. I had to go over and meet with the new chief. I have to go over and meet with the new directors over different departments and really explain the work that we do, go over our contracts, go over how we do things. A lot of it is training. A lot of it is out there in the community doing work and meeting with people. So it's not an overnight success. You have to get that buy-in. And that's part of that culture and knowing what those agencies are doing and how we can support them in getting their work done. And everybody wants to divert from juvenile justice or divert kids from getting involved in different systems. And part of that is, hey, let's do this thing here. Let's do business differently. And getting them to buy into that. And like Nydia said, she's been around a long time, advocating and working on behalf of not just her own family, but just kids and families within Travis County. It's not a one meeting and sit down. It might be multiple meetings. It might be us really having to look at how our contracts are written. Having multiple meetings regarding our MOUs and getting everybody's input on them and getting a language changed. I think it took us almost 6, 7 months to get our MOU to where all the attorneys approved it. You know, and then when you get change of directors or people that signed that original MOU, you still have to bring it back. So it requires a lot of work. So you have to have the time to do that. This is not a one man or one person operation.
Yeah, absolutely, Sonia. And I think something kind of building on that relationship building piece, something that I really heard is around, coordination and collaboration. And I think a lot of times what I hear from communities doing this work is, they get the people together and they're in the room and they've got that governance board structure, but sometimes it's really hard to take it to that next level. So I'm going to go ahead, I'm going to share something really quick, but it makes me think of, we just were recently in a conference in Bethesda. Oh, give me a second. I always have a hard time sharing on Zoom, y'all. Oh, you get to see my whole screen,
Yes.
all my desktop, all my icons. But this was something that they shared when we were at a grantee conference last month in Bethesda. And really I think a lot of times we say we're collaborating, but really we're further over here on the left side of this continuum, right? So sometimes we're networking, we're exchanging information, which is great, right? That's the first step. We're at the table together, we're exchanging information. But as we move down this continuum, how do we, change our work so that we're united around a common purpose? How do we begin sharing resources, right? Maybe that's staff, maybe that's space that we're sharing. And then when we're getting to collaboration, right? It's really this next level. We're learning from each other, we're enhancing each other's capacity, right? So I think my question is, a lot of times I think some communities get a little bit stuck on that networking side. What have you done and how do you kind of push things along this continuum so that you really have that buy-in and you're really working towards this true collaboration between different partners?
I know for me, sometimes I have to back out and let the people that handle the money and do the budgets and stuff like that. And that's okay. Because sometimes there's decisions that are way above my head. And sometimes they want to talk to the person that's actually going to submit the budget, fight for the budget, advocate for it. And so then my director, which is Laura Pivotal, will then step in and she will do that piece. But on those day-to-day collaborations, it's really, I'm there to listen to what they want. And then if I have to tweak something, like when Del Valley could no longer take 10 families under the Children's Partnership, we had several meetings discussing it, how to modify it, how we could continue to keep them on as a partner. And we agreed upon 5 under partnership. And then she's also their parent support specialist. So she's carrying 2 duties. But it's like you have to be able, like you said, to bend to meet the needs. What I want is this. What they can give me is this. And so I have to be willing to take what they can give me to meet the need that I have. And then gathering that data afterwards and bringing that data with you to say, hey, it looks like a small number of families that we're dealing with, but what we're dealing with are those kids that have, the police coming out to the campus, that are shutting down classrooms, or that are in and out of hospitals, in and out of RTCs. How do we help y'all keep this kid so that you're not having to get to a point? No school district wants to pay for placement for you, but if you can't educate that child within your setting, then that's where it goes sometimes. So how do we partner on that? Because we all want the same goal in the end, even though it might be worded differently for them. We want that child and family to be successful based on what their definition of success is.
No.
I hope that answers your question. Sometimes I just start going because I'm really passionate about some things.
No, absolutely. And I don't, my dog's losing it. Yeah, absolutely. Absolutely, Sonia. I think that's a great point. Also, like bringing back the data and the information to show, what the outcome is, what's been achieved, to really show like what that value is through that partnership.
And even the historical stuff, bring that back. That's why when I took over this position, I didn't throw away those binders, even though they took up a whole bookshelf in my office. It's like, let's keep the history, because you never know when you have to go back and they might ask a question about something. That history is important. And reminding them, we've been together, we've been through this, we've been through ups and downs. So you can't give $120,000 this year. What can you give? And like another partner is juvenile justice. They're not always utilizing all the money they put in. So they're trying to figure out, how can we serve more kids and access all the dollars and use them up so that they don't get taken off the table. So you're always talking about that as well. And how do you do that? And so you're always looking at those different things. And the other piece is, what do they want? What is it that you guys want? And what can we help you with? Do we have a common goal, a common ground? And it sounds easy, but it's not. I mean, saying the words is one thing. Sometimes you have to bend over backwards. Sometimes it may not be this year, and it may be, and I'm coming back next year to ask the same questions and to meet and to discuss and see if we can get you on board. So it's a continual cycle. So somebody you get this year, you might not get next year, or vice versa. So you have to keep that continual cycle going of having everyone involved. And sometimes it's finding people within the organization that do believe in the work that you're doing and having them to partner with you as well as you're presenting that information to those people.
Absolutely. Have any more questions out there for Sonia?
I'll kind of, I keep quoting you, Sonia. Another thing you said was SOC and wraparound is about values. You don't need money to do that. It's about how you interact with people. Sarah talked at the beginning how we have this grant structure or initiative of system of care, and we're kind of both, right? We're the framework for the state, and we also have these grants. But and Sonia, you talked a little bit at the beginning about the grants and how they've ebbed and flowed. But I think what we would really like to focus on is that part about the values. Can you talk about, and and selling it? I think in the fundraising, to me, all of those kind of go together. And I know you've mentioned several times your parent liaison, family voice, youth voice. I think that's where we struggle is sharing about those values. Can you tell us more about how you all do that?
Yes. So I think I mentioned earlier, all our staff are trained at NWIC, and that's about the wraparound process. But also all of our staff are trained on system of care and the values of system of care. And when we're doing the work that we're doing, even at our local CRCG, our parent liaisons, we have 2 now. We originally had 3. We have 2. One of the parent liaisons changed positions, and so she's still there. She still has that lived experience, and she still advocates for families. She just has different job duties and responsibilities, but they have different experiences. One is a certified family partner. The other is not, only because her lived experience is for her sister versus her own child. And then our other parent liaison went to become our system of care navigator. And so works directly with me, really with getting out in the community outreach and stuff like that. But I think the real value to me is when we talk about community-based, what does that mean? What does that mean to you? They're in the community, but that's not always true. So community-based to me, and what I try to share with my staff, and we start a lot of our meetings based on these values. Same thing with our CRCG. We're not going into placements. We're not asking for placements when we first come in there. We're talking about what community-based services can sustain this kid at home. How do we work with families in their community? And that's as easy as, if you're going to set up a treatment, how is the kid getting from point A to point B? How's the family doing that if they have no transportation? How do we give resources to the rural parts of Travis County? So community-based is also knowing what's in that community. So if you've never been in the community, you don't know what's in the community, how can you work with families, access resources, give them ideas and suggestions on how to work if you don't know what's out there. Community-based is just not about, oh, call NAMI or call parent to parent and get online with them. But is this a resource that's going to be beneficial to that family? Have you researched it? I mean, I can give you 30 recommendations off the top of my head, but it doesn't meet the needs of those families. It has to be individualized for each and every family that you're working with. Even though it might look the same as far as, oh, they need a mentor, or, oh, they need an IOP of some sort. But what is that IOP for? How is it working with that family? Is it close to their community? Is it something that they can sustain once we're done working with them? Y'all see my office mate here. Child-centered and family-driven, having them there. We don't meet, you can't meet and make decisions about services and supports or talk about a crisis plan or talk about their treatment plan without the child and family present. They have to be there. You can't sit in your office and do this work. This is an in-the-field home visiting work that you have to do with families. And it doesn't, and some families have mandated services. Some families may not understand why it is that they have to do this particular modality or therapy, and they don't want to do it. And it's working with them, it's educating, it's empowering, it's listening to their voice, it's reframing, it's retelling their story to make sure you got it right. It's giving them your undivided attention so you know what it is, so you know what those next steps may need to be. And also listening to that child. Just because a child has challenges or issues doesn't mean they don't have a voice, that they don't know what they want, that they don't know what triggers them, and that they don't know what they want to participate in and do. We think, and I'll say this, and some people might cringe, we think therapy is going to resolve everything sometimes with our families. Some kids have had so much therapy, they can be the therapist. So sometimes you have to look at things differently. And that's where that child and family voice comes in, and let the family be the driver of the bus. Yes, we're the facilitator, but we have to partner. And a true partnership means that sometimes we're the passenger on the bus. And then linguistically and culturally competent, being aware. And that's just not with our families, that's with our communities, that's with our agencies. And I'd love to say that we have somebody that speaks every language for every family that we work with, but we don't. But we have to do the best we can to provide them their services in their first language and work with agencies to understand. You can't send home this paperwork in English and moms speak Spanish and she doesn't understand a word of English. So how are you expecting her to collaborate with you? So sometimes you have to be that advocate. And sometimes it's a 90-10. You're doing 90 and they're doing 10. And then eventually it's 80-20. So you have to work with what you have, and you have to realize that you may get doors unanswered. You may get phone calls not returned. You may see them peeking through the curtain and they still won't answer. You may have missed appointments. You may have all of these things, but that doesn't mean that they don't want to work. It may mean that they have a lot going on in their lives. It may mean that the electricity just got turned off and they didn't want you to come in and know because they haven't built that trust up with you. They haven't gotten that engagement with you to where they know that you're going to be there for them and not against them. Because a lot of our families have come across system blocks. Sometimes systems are barriers, and we have to come to them. That's how you have to, those core values, that's how it's implemented, because you're looking at them differently. It's not, I have these boxes to check off, but let them to create the boxes. And you don't have to stay within the color lines. You know, you can have a hexagon, a pentagon, you can have all kinds of shapes. Let them have their goals. Let them create them in their voice so they understand them. And I think that's how you implement those values in your system, and you explain that to everybody you're working with. Because even in our CRCG, we say we implement the values of system of care. So we're going to go with the community first. We want to hear what the family has to say. We want to, we're not dictating. I'm not asking them, I'm the chair of that particular meeting. I'm not asking them to make a commitment. I'm asking them to be open to these suggestions. And at the end of the day, if they want to take those recommendations, ball them up and play trash can basketball with them, that is okay with me. Because I have 45 minutes to know their child. They've had a lifetime. So does that answer your question, Nydia?
I think, yeah, I think that's so powerful. And I can attest, having worked with our system of care or CRCG in Travis County for a lot of years, that they really do that. They really take into consideration what the family goals are and where they are. Just yesterday, I was in a meeting where we were talking about it's not just about giving a phone number or, giving a referral or I did a presentation and I'm like, please don't tell a family, just email, just call, just contact, because it's not just, right? There's a lot behind reaching out to someone else, or as families, we know that it's not just. We know that there's time and emotion even involved in making those connections. But when you know that that organization has really listened to you, right, as a family system of care value, listening to families, um, and maybe even that organization has helped facilitate with the family and the youth, right, that communication, and then having those warm relationships within their community so that they're just not giving out referrals that don't meet their need, whether it's important to know insurance, it's important to know funding, it's important to know just kind of those, I don't know, perimeter eligibilities when giving those referrals. So I think that that's really important. You don't need money in order to have that in order to know your community and have had those relationships when you're helping families to connect. I think that's really important.
Yeah, the other thing I would like to add, and I usually do this in my training because I'm one of the trainers here at Travis County, is that it's not about us. So we have to leave our biases at the door. We have to know what our biases are. We have to know our own shortcomings when we're working with families. And we have to, I tell my staff, or even when I do a role play within the training, I don't take that, you have, I'm going from my probation days. I had a kid one time, he had 2 binders, about 3 inches to each binder was 5-inch binder. But if I just read that 5-inch binder, I go into that meeting with maybe some thoughts already in my mind. And instead of listening to the family, I'm already in my mind, I might be saying, oh, they lying. I read what they did. Oh, she's just making up excuses or whatever. Go in there is like you don't know the family. Allow them to tell you their side. Allow them to tell you their impression of what's going on. And don't be worried about, whether they got a 75-inch TV and their kids got on the newest kicks, but they can't pay their rent, or whether the house is nasty. If it's not neglect or abuse, there's no need to call CPS. That's not what you're there for. You're not there to help them clean up their house. To them, they may have done the best they could that day just so you could come to their house. And if you're focused on the wrong things when you're meeting with families, then you're missing things. And then you're trying to problem solve solutions that they're not worried about. And then keep in mind, families that we are no different than the families that we serve. Somebody took a left or right, or we have some of the same experiences they have. We might have had a better support system. Even with all my knowledge, when I go to an art, I'm still reading over the idea. I'm still looking at this IEP. I'm still nervous, just like our parents are nervous. And we have to realize that they are human beings and that we have to look at their circumstances when we're meeting them. And that's part of that value system, is meeting people where they are at. It doesn't mean just meeting them at their house, but where are they at emotionally? Where are they at physically? Where are they at cognitively? Because sometimes you give a whole list of stuff to a family to do, but if mom doesn't read English, or she only finished the 3rd grade and she doesn't know how to catch the bus because she doesn't know how to read the signs, how do you expect her to read this list of phone numbers that you gave her? And what questions to ask? It is okay to handhold. Same thing with our grantees. We haven't had a grant since '85. We've supported some of the system of care grants here. We know of some of the system of care grants within integral care and things like that. We make referrals to some of the programs. And we try to figure out what they're doing and how we can collaborate to get some of our families into those programs. And we're always on the lookout for it. We're always trying to see if it's a good time to do it. Do we have our partners buy in supporting us in doing a grant? And so it's the same thing with our families. What's going on? What's the climate? How do I respond to that? You know, and you have to know because, you know, when you're looking at families, they're being impacted just like we are by everything that's going on. And systems are impacted by what's going on in our communities as well. And we have to take all of that in consideration when we're collaborating with people, when we're trying to get them on board. Who mandates their funding? The state says they're not going to pay for this or for that. Then maybe, you know, we can get them in and they can be a partner, but we can't access their funding because we're serving these particular type of youth or family that the state no longer wants to serve. You know, politics is politics, and I'm one that not to delve into that. But I'm more about what can I do? You know, how can I, you know, this is what's going on and I know it's going to impact people, but how can we still serve?
Absolutely. Yeah. Thank you so much, Sonia. And, you know, we do have some state level folks on the call today, including myself, and that's part of our work, right? Is how do we, you know, work to embed those system of care values in our agencies and our programs. And that's something that we're always trying to push forward. So we've got about 4 minutes left, and I promised I was going to put you all on the spot. So I still need to make sure that I do that. But it's come to my attention. I know a lot of the folks on this call are familiar with system of care, but I think we've kind of got like varying levels of familiarity. So I did want to share one more slide again. Once I figure out how to share my screen, y'all. And again, this was also from the conference in Bethesda. And I just thought this was a really great, accessible way of explaining system of care, what it is and why we do it. So it says, you know, mental health challenges do not impact only one part of a person's life, but the whole of their life and their family. And again, I had put this in the chat earlier, but a system of care is an approach to coordinating efforts by agencies, organizations, families, and youth in a community so that services and supports are accessible, appropriate, and lead to positive outcomes for everyone. And a lot of what I heard from Sonia was about the values, right? So part of system of care, we're talking about services and supports. We're also talking about infrastructure. That's our governance board, you know, could be funding, but we're also talking about the philosophy. And I really heard that come out in Sonia's presentation. How are we ensuring that the work that we're doing is family-driven, youth-driven, community-based, and culturally and linguistically responsive? So what I want to do with these last few minutes, some of you completed a quick survey when you were registering for the call, talking a little bit about your system of care efforts. And I know not all of you may be doing, you know, direct system of care work in your community. So I want to open this conversation up to everyone. But I want to hear a little bit about, you know, from Sonia's presentation, from this framing of system of care values, what have you done in your community and your program and the work that you do to incorporate some of these values into your work? Or are there some ideas you got from this presentation to move forward with incorporating those values into your work? So we've got 2 minutes if you guys want to do something in the chat, but if you're really brave, I would love if somebody would come off camera and share a little spiel. And again, system of care values, youth-driven, family-driven, community-based, culturally, linguistically responsive. If you've been doing system of care work in your community, how have you built in these values, or anything that you took from this presentation in terms of, you know, maybe a concrete way or two you can try to build these values in moving forward. I might even give you a prize if you speak up. And yes, you can absolutely put it in the chat. And yes, I know it can feel overwhelming and stressful to share, but this is a safe space.
Sarah, my name's Emily Eisenman. I'm with our Tacomi program, and I just big thanks to our presenter that shared today. And while we are a statewide program, so I don't have something necessarily local within our model of Tacomi and continuity of care, we have brought many of the things that when we attend system of care meetings into kind of our programmatic practices, guidelines. We work collaboratively with TJJD, where that justice, kind of how do we help divert people. Every single one of our programs is required to do all of their contacts out in the community on a routine basis. Our caseworkers are meeting the youth not only in school, like within the school, but also at home settings so that that family is a part of it. And really trying to build kind of that bridge gap where it isn't just a behavioral or mental health treatment service sitting all by itself, but that it is a full picture that includes what do you actually need to accomplish in order to successfully complete justice requirements so that you're not engaging with us as justice any longer, but also teaching the youth kind of how to engage with their local mental health authorities specifically. And kind of maintaining that stability piece. So we always borrow, especially language use. Justice tends to be a little bit harsher sometimes in how it uses language from all of the different presenters that share and present. So we just want to say thank you, but that's kind of how we use some of that system of care approach. We encourage our program directors to join any of the CRCGs. Obviously, a larger part of our population does happen to be adult, but we even borrow some of that into our adult systems. So thank you.
Yeah, that's awesome. Thanks, Emily. I think that's a great guide. I think there are a lot of state folks on today to kind of understand what we can do at our level to really pull in some of this work. And also, we've been developing the Children's Mental Health Strategic Plan with the child serving agencies. And that's a place where we've really been able to pull in the system of care approach, bring in those values. So that's another thing that's really exciting that's going on at the state level. And then Leah, one of our family partners from one of our sites, Integral Care, she says that she consistently tries to make sure family voice is included in conversations with staff that impact planning and access to services, making sure families have direct connections to advocate for themselves and help them to make those calls or connections and model those conversations if a parent might not have the experience yet. So yes, that is awesome, Leah. Leah is amazing. Thank you for all you do. I think we are a little bit past time. So I do want to respect everybody's time. Tammy, is there, or somebody on the TimeH side, is there a survey that we send out to this group, or will that happen after the call?
It'll happen after the call. I'll email everybody who's here today for a very brief evaluation to tell us what you thought about today's meeting and meetings moving forward. Thank you, Sarah.
Absolutely. Well, thank you all so much for joining. And just such a huge thank you to Sonia for joining and sharing all of her expertise. We really appreciate you being with us today.